Hi, this is Stephanie, and in this video I'm going to talk about my pre-operative visit and what the prep is going to be like for my upcoming surgery. Surgery is going to be in 2 days, so it's finally here, and the time has passed really quick. This past week I had a meeting with my colorectal surgeon, Dr. Derby, and in this visit we discussed the type of surgery that I was going to have and any last questions that had come up during that time. And as I've stated before, I have decided to have my complete colon removed, my rectum removed, and the anal canal closed. As I've told you guys before, the reason I'm having my rectum removed is that it's completely worthless and there would be no chance of it being healthy enough to be reconnected in the future. And I'm having my anal canal closed because there's no use having it. So that has added time onto the surgery. The length of the surgery is going to be 3.5 hours approximately. And with the anal closure, I will have an additional scar on my backside, but who cares? My incision, it's going to be an open surgery, not laparoscopically. So it's going to run vertically from my belly button down. We'll talk about this little bandage in just a moment. So I'll be in the hospital probably 4 to 5 days, which is going to be a bit of a challenge for me. I am taking plenty of books and my laptop and things like that. After surgery, I'll be in recovery for probably an hour and a half. This is what is expected in most surgeries, so we're not exactly sure what's going to happen, but general terms. So after I come to, I'll be eating ice chips. Yum. And excuse me. And then if everything's going fine with my ileostomy, I'll move to clear liquids and then jello, things like that, and then hopefully solid foods, not too long. The prep for this surgery is very similar to what prep for a colonoscopy would be. The day before the surgery, all clear liquids. Big surprise. But the cool thing about this time is there's no food coloring restriction, so I can have things that are red and blue. So I'm going to be drinking grape juice, which is different than last time. And also there is a laxative prep, and I'm doing half lightly. So tomorrow at noon I'll be taking 2 laxative pills that come with it. And the way half lightly works, you take those tablets, and then after your next bowel movement, you start drinking the concoction. It's half a gallon of stuff that does come with flavoring packets. So I'll be doing a little video tomorrow on how yummy that tastes. And then you drink 8 ounces every 10 minutes until it's gone. And then by that time, your stool should be clear or yellow. So that will be tomorrow. After I met with Dr. Derby, I met with my stoma nurse, or WOC nurse, and we talked about what an ileostomy is, and since I'd already done research, the visit with her was pretty short. She also did my stoma placement, and that's what this bandage is right here. She looked at my belly, and she looked at where I wore my pants. She also had me lay down, and she felt my ab muscles by coughing and everything to determine where the best placement for my stoma would be. She decided right here. The flange of the bag is going to be about like this. So as you can see, it's not interfering with my belly button or where I wear my pants, because that would affect the adhesive. And she said the optimal placement is as close to your midline as possible, but you don't want it on a fold of your skin, which would be where you would bend, and you don't want it where your pants are going to affect it. So that's where my little buddy is going to be, or my alien as I've been calling it. What's funny about that is, my surgery's in 2 days, but I've already had 2 dreams about having my ileostomy and having the stoma, which is really weird. And from checking out some of the websites online, a lot of people have dreamed about it. I found a great website. It's called C3 Life, and there's tons of information on there about living with an ostomy. I'll be linking that for you at the end of this video. And they've got a wonderful section on forums, so you can ask tons of questions. They have blogs and videos, which is pretty cool. After I met with my stoma nurse, I met with the anesthesiologist, and he asked, 1,100 questions. Do you have heart problems? Do you have breathing problems? Everything like that, to make sure that, I'm healthy and there wouldn't be any foreseeable problems putting me on anesthesia. They also did some blood work. Who knows what they're testing for, but to make sure there's nothing wrong with my blood. And if I needed a transfusion, during the surgery, they would have the information on hand. I also got this handy dandy bracelet that I've been having to wear since Wednesday, that the lady told me for no reason are you to take it off, but she left it loose enough so when I take a shower I slide it off and slide it right back on. But please don't tell her, because I'm afraid she'll come get me. So after I come out of recovery, we discussed 2 types of pain relief. One is a morphine drip, which I would have a pain pump and be able to depress it when I needed pain. And of course it's regulated so you can't OD on it or get, tripped out on morphine. The other option was to have an epidural, which is similar to what pregnant women have, but in the case of this, it wouldn't be as hardcore because they do want you up and walking as soon as possible. I decided to go with the pain pump, mainly because I'll be able to control it, and the epidural kind of weirds me out. So that's what I'm that's what's going to happen going forward. I'm getting prepared. I'm ready for it. I've got my bags packed and all of that stuff. I've been eating anything that I've wanted, and I'm pretty sure I've put on about 5 pounds in the past week, because starting tonight at midnight, I won't be able to have anything but clear liquids until goodness knows when. So tonight at 11:50, I'll be having a cupcake and some chocolate milk, and I'm looking forward to that. Another thing that I wanted to mention is there's this great website out there also called Ostomy Secrets. The owner, Lisa, started the company when she had her ileostomy and was uncomfortable with the feeling of the bag and hiding it in her clothes, so she's come up with a line of underclothes that have pockets on the inside so that you can discreetly have your ostomy and it not show under your clothes. So if you're looking for things like that, if you already have an ostomy, be it urostomy, colostomy, or ileostomy, you should really check that site out. She's got great products for men and women. I've gotten mine and have already tried it on, and it's going to completely cover everything up. There's not going to be any kind of bulge in my clothes or anything. So that's very cool, and thank you, Lisa, for coming up with these products. So that's it for now. I will be doing another short video tomorrow on what half-lightly tastes like. And the next time I see you will be at the hospital for my surgery. I'm hoping to do a video of me getting ready and what's happening there. So until next time, stay positive and stay strong.